Thank you all for joining me today for a very brief webinar on the introduction to healthcare regulation. Now, firstly, a quick introduction to me for those who don't already know me or haven't attended one of our previous webinars. My name's Tara, and when I'm at work, I have a few hats. I am currently the Learning Response Lead and Patient Safety Incident Investigator for an acute hospital trust. And I also support Thornbury Nursing Services with consultancy projects, specifically those that are looking for regulatory compliance. Now, I am an adult registered nurse and I have worked across a whole variety of clinical and non-clinical roles in healthcare, and more predominantly those in clinical management, risk management, and more recently as an inspector for the Care Quality Commission. Now, before we get stuck into the content of our webinar, I will give a quick introduction to Thornbury Nursing Services for those who haven't used our services in the past or haven't heard of us through the webinars that we've been delivering monthly. Now, we are predominantly known for our last-minute nursing services, and we provide nurse and care staff when no one else can. But more recently, with access to such an extensive database of highly skilled and expert staff, we also provide support solutions via our consultancy team. Now, I won't go into this in depth because I'm sure most of you have heard this on previous webinars, but Thornbury Nursing Services sit within a wider group called the KCM Group, who are a leading global healthcare delivery partner and have been for over 40 years. And you can see just on screen there quite the breadth of brands that sit within the KCM Group, and Thornbury Nursing Services sit there in that first group of global health and social care workforce solutions. But that is my quick introductions over. So let's get cracking with our topic today of healthcare regulation. Now, as we all know, health and social care services are a vital aspects of our lives, of those around us, and so ensuring its quality and safety really is of utmost importance. Now, in England, if you run a health and social care service and you provide what's known as a regulated activity, there are certain things you have to do by law, and these laws that we are governed by are known as acts and regulations. So what do we mean by acts and regulations? So an act is a statutory legislation that have been passed by Parliament, and that simply means that they are laws. So breaching an act could see you ending up in court. And acts go through a demanding process before becoming law, which includes agreement from both houses of Parliament and has received what is called royal assent, which essentially is the monarch's agreement. Now, regulations are additional to acts. They link to an existing act and they help people to apply the content of what's in that act. So essentially, they are the detailed rules that are created to describe how an act should be put into practice. They are generally created by government bodies such as ministries and executive agencies, as well as independent regulatory authorities. Now, they don't go through quite as rigorous a process as acts do. So it does mean that they can be slightly more easily altered or updated compared to legislation. And that just helps keep it current with today's practices. So health and social care providers are bound by law under what is called the Health and Social Care Act. And that is for the provision of services that they provide. Now, there are two groups of regulations that detail how providers should be meeting this act. That first set of regulations is regulated activities, the regulations of 2014. Now, these regulations set out 13 fundamental standards that ensure provision of regulated activities and care have a benchmark in which they should not fall below. Now, the Health and Social Care regulations of 2014 include the core requirements for care services that involve things like consent, person-centred care, premise safety, equipment suitability. There's lots, and we'll go through them shortly, but I won't list them all quite now. And the second group of regulations are regulations of 2019. And these regulations detail what a provider must meet in order to register a new service and to continue to meet to ensure their ongoing registration with the Care Quality Commission. Now, they include regulations relating to notifications of changes, absences, and other events or incidences.